All right, everyone, here we are again with Dr. James Schaller out of Naples, Florida. And we are now going to shift our discussion to treatments for Babesia and just Babesia in general. So Dr. Schaller, take it away. You know about Babesia, so we really want to hear from you.
Well, around 29 years ago, plus or minus a year, my family was very sick. I was also very sick. My patients were very sick, and nobody could figure out what was going on. I first realized that Lyme was present. There was nobody there to mentor me, although there was some guides and other things, but nobody that could really help. So I started addressing that, and that was helpful. But I quickly became apparent there was more going on in Lyme. And so I discovered Babesia and read everything I could get on Babesia, crates of material. And so I wrote a number of Babesia books. Again, they're free on my website, personalconsult.com. I don't need your money. The books are free. But I want to talk a little bit about mistakes that I'm seeing that very good people are making, even people that I admire and are kind of heroes to me. So obviously I won't mention their name. The first thing is I'm seeing on my personal Facebook the notion that one treatment will work. I don't believe one treatment will ever work. It doesn't matter what the treatment is. So the first thing you have to ask yourself is, do I really want to, I'm really ready to get into this and treat it. Now, that doesn't mean if something makes you nauseous, you ignore that. You never ignore nausea or discomfort or diarrhea, etc. The other thing that's out there is that the herb Artemisia, that's just the plain herb, that doesn't kill Babesia at all. And I have a textbook on that, free on my website, all the forms of Artemisia. Now, that Artemisia plain basic herb, that probably will kill malaria. It will not kill Babesia. And so what I recommend as one of the things to kill it, you can get from the Zhang Clinic, ZHANG Clinic, New York City. That brings it right up. And the product, you can say Artemisia or ART-E as in England. And that is actually artesunate. All you need to know for our purposes right now is that is semi-synthetic drug. It is not a simple herb, and it's quite strong. And the more you can take of that, the better, without being uncomfortable. Now, another thing I'm seeing a lot of is the recommendation to take artemisinin, I-N-I-N. And I won't get into all the ways that word's used, but I'm just talking about the product you see on the shelf, and it says artemisinin. That is, in our research, we found that was too weak to kill Babesia. Now, there are people I respect, and people who are respected with ILADs who are Babesia experts, and they feel it's helping. I just didn't see that in our research that we did quite a long time ago. So I'm not interested in reinventing the wheel. I am using Coartem, but, and that's a combination of two drugs, CO as in co-pilot or two pilots. This is two drugs. And the thing about it is you probably have to go very high on Coartem for it to do much. And I'm not impressed that it's curing by itself. Now, mainstream infectious disease doctors like Mepron, MEPRON, and the generic of that is atovaquone, ATOVAQUONE. It's a disgusting yellow liquid, and you want the liquid instead of the tablet if you can, because the absorption is higher. And if you're able to take an omega-3 fatty acid with it, or any kind of fatty whatever, it gets absorbed much higher. Now, in the past, people at Ivy League suggested 2 teaspoons a day. I strongly feel that I was seeing Babesia untouched on 2 teaspoons a day. So I recommend 4, and I've even gone higher, but I'm not saying that to anybody but my friends right now. So that's our little secret. The other thing is the pharmacist may say, well, we don't have the liquid atovaquone. Why don't you use the Malarone? The thing about Malarone tablets is it has the atovaquone, but it's in a solid, so it doesn't do much. Remember, it has to be liquid with fat to really be absorbed. But Malarone has a drug in there called Proguanil, which at times can be helpful. I tend to go higher than some other doctors. I like 3, even 4 a day, but that's something you work out with your doctor. We also like Alenia, which the chemical name you can look up, but it's ALINIA, and we get that from Cripps Pharmacy, KRIPPS in Canada. Just put in Cripps Pharmacy, it'll come right up. And that's very cheap. I believe that is probably killing some Babesia. There is a feeling that ivermectin may kill Babesia. I'm only aware of one paper saying that, but some of us believe it's probably doing that. And the last 2 is Lariam. Lariam is the brand name, and that's been around a while. You just got to be careful with the psychiatric symptoms of that. In my experience, most people are fine, but be aware and let people know they may have mood changes and those need to be addressed. The final one that is very important that is not used enough, and I published it in, I don't know, 2006 or 7, is Primaquine, PRIMAQUINE, 26.3 milligrams. And sometimes it says in parentheses, 15 milligrams. I wouldn't worry about any of that. You take it daily. It's not $1 million like some alternatives. With GoodRx, it's $50 a month. That's very affordable. It's been around a very long time. There shouldn't be many surprises. So those are a couple ideas to see about getting you 2023 Babesia treatment. And more things are coming because more malaria drugs are coming, and Babesia is the theft of malaria drugs.
Okay. Thank you. That's extremely informative, both for patients and physicians. I remember when I was at my worst with Babesia, I basically stopped breathing. This was before I met you, Dr. Schaller. but I basically stopped breathing. I had the terrible night hunger, where I'd wake up and gasp, and I couldn't breathe. And basically within just a few days, it just became so bad that I couldn't breathe any longer. And when I truly say I stopped breathing, I could no longer breathe. So my body was keeping me alive by keeping me awake. And I had a choking feeling in my heart and into my chest. And when I did try to lie down, even just for an hour to try to sleep, I would get a debilitating migraine that is just inexplicable. I can't even begin to explain. And that was likely because there was no oxygen going to my brain. And I knew instinctively that I probably had a couple days to live. And I did contact a clinic in Mexico, and they were willing to start me in on red blood cell exchanges immediately, which, in the United States is very difficult to get because, number one, well, it's hard to detect Babesia. That's another whole problem. So one of my tests, I think for my Genix, or one of those reputable companies that does the tick-borne infection testing, private laboratories across the US, my Babesia duncani was off the charts. Now, I did also test positive for microti, which is harder to find, I guess, from the knowledge that I've learned. But given that my Babesia duncani results were off the charts, of course, in hand, I had very well proof that I had this horrible Babesia problem. So I flew down to Mexico. I was so exhausted and tired because I hadn't slept in probably almost 2 days. I knew I was on my last leg, and they started me in on, altogether down there in Mexico, I think I had about 20 red blood cell exchanges. When I say 20, that meant 2 bags each of 350 milliliters of bags of blood from some stranger that I paid for. And I laid my hands on every bag of blood, and I said, whoever you are, thank you very much for saving my life. And within probably about a week's time, even with the first, I think we did 3 red blood cell exchanges a week. So that meant we did 6 bags of 350 milliliters a week. And we did that over the course of roughly 4 months. And we tried to get that parasitical load out of my body that was so intense. And within just a week or two time, I felt almost as if I had just been given a new life. I was just hanging by a thread. And so I did what I did in Mexico. And then I actually went to Germany to another clinic there. And they proceeded to perform other things that I asked them to do. I actually even underwent experimental chemotherapy. That's another whole thing based on my own research.
Sure.
I said, look, you know what? Just use me for science, whatever. If I'm meant to live, God will keep me alive here. So they gave me another 40 red blood cell exchanges, clearing out more of the parasitical load. So I had 80 red blood cell exchanges in this roughly 1 year period. Now, I don't believe it didn't cure the Babesia, but it greatly reduced the load that was about to kill me. And probably some of the Bartonella, because the Bartonella rides on the exterior of the red blood cell. Is that correct?
In and around, yes.
In and around. So it greatly helped me. Now I know that I was still, I guess, testing positive, but on a much lower scale. And of course I wasn't having that terrible air hunger. I could actually breathe. And so I for sure firsthand know the risks of Babesia and how it can absolutely be completely fatal in a very short period of time if gone untreated. So I very much 100% agree with everything you've noted. And I just thank you from the bottom of my heart for your research, because there aren't a lot of physicians that will explore this material or even understand it. Not necessarily because they don't want to, but because they haven't been introduced to it and they don't really know much about it.
Exactly. I think you're totally right. Those are very useful treatments. I tend to reserve them for very dangerous situations like yours. The other thing that I didn't mention that you triggered was there's a number of different ozone treatments where you may take the blood out of the body and then put ozone in it various types of ways and put it back. My experience is that also lowers body load of Babesia, but also Bartonella and Lyme and other kinds of infections. I've never seen it cure, even though people claim it does, but I have seen it drop antibody levels and drop blood smear levels.
Okay. Yes, I did do some of those ozone treatments. I found the red blood cell exchanges were just generally more helpful for my situation, but I did also do some of the ozone treatments. The problem is, gosh, this is, I call it a millionaire's disease because unfortunately it's so darned expensive and people have to really kind of pick and choose what they can do and what they can afford. And some of the drugs, as you've noted, in certain states are covered by health insurance. Thank God Massachusetts is one of those states. I think Virginia is another one. And I think there's a couple other states that do cover extended treatment and care for chronic Lyme and co-infections. And so thank God, I'm in a state. I just thank God every day because I know across the United States, there are so many people who are suffering who just have no medical coverage, even with their insurance, or their insurance denies the coverage for various reasons. But hopefully in the future that will change. I'm going to work on that change. So that's my job. I'll work on that change. So with all of that being said, Dr. Schaller, is there anything else you'd like to add in the last couple of minutes for this Babesia chat?
Well, just that 29 years ago, there was nothing out there. There was so little information. And now, I mean, I've written about 6 books, but so many other people are adding to what we know. And every 2-3 years, there's more knowledge, more information. I do think there needs to be more research on treatment, but it's not being ignored like it used to be. So I would say with all these infections, including Babesia, it's log growth. Every year it's double or quadruple or 16 times the amount of papers than a couple of years earlier. So it's a very exciting time, and I would be hopeful no matter which of these you have.
Okay, that's a very positive statement for the audience because there's so many of us that just don't have hope and we're almost lying in bed to die. So I am appreciative of that. Thank you, Dr. Schaller. And thank you for this Babesia discussion. And we have more discussions in line. So stay tuned, audience. We are going to move on to some other topics. And we thank Dr. Schaller today for his very valuable input on Babesia with his clinical experience and research experience and all the other experience that he has had with Babesia, treating Babesia. So thank you, Dr. Schaller.
My honor, Valerie.